Well, state epidemiologist Dr. Jennifer Dillahay says if all goes well with this Pfizer vaccine, we could start to see the first doses here in Arkansas before the end of the year. However, most Arkansans will not get immediate access to it anytime soon.
This is hopeful news about the Pfizer vaccine, but there are still important steps that have to be made before it can be made available to the public. And of course, when we first receive it, there won't be sufficient doses for everyone. So high priority groups will receive it first.
Which could mean months before the average Arkansan sees the vaccine. In the meantime, nonprofit Immunize Arkansas is getting pharmacies and community clinics ready to help with the distribution by first training them with mass flu clinics. They launched their online training resources today.
And so they're going to be doing curbside and drive-through clinics because since we're in a pandemic, you can't really do mass flu clinics like we think of where people just stand in line and get their shot. They have to be done in an unconventional way. So this training is really just so that people know how to do a mass flu clinic in a pandemic, and it's to set up the infrastructure for when we get COVID vaccine.
And it'll be months before a mass COVID-19 vaccination clinic is an option in Arkansas. But Mercer says it's best to be prepared, especially ahead of the winter months.
We don't want what they're calling a twindemic with flu and COVID. So we're hoping that those high-risk populations are getting their flu vaccine so that they're not at risk for developing flu and COVID at the same time.
So once that vaccine is approved, Dr. Dillahay says it's up to the FDA to determine how many doses each state gets. That's typically based off a population. And Dr. Dillahay says at this time, they do not know how many doses Arkansas is going to receive in that first shipment.
And Jamie, after healthcare workers, who's eligible for the next phase of the vaccination?
Well, Paige, according to Dr. Dillahay, their next target population is going to be the more vulnerable population. So that's people who have underlying health conditions, as well as people who live in the ethnic communities that have been hit hard by this pandemic. That includes the Marshallese community as well as the Latinx community. So again, for the average Arkansan, it's going to be at least months before you can get access to this vaccine. Paige, back to you.